Hi, I'm Dr. Shade Fari, pediatric pulmonologist, and I'm a children's lung specialist in Wayne, New Jersey. As a parent, hearing your child cough at night can be exhausting and worrying. Today, I'm going to help you understand how a persistent cough is when a persistent cough is just a part of childhood and when it's time to dig deeper. Let's get into it. First, when a cough lingers beyond 4 weeks, about a month, then we start calling it a chronic cough. It's completely normal for children to have 6 to 8 viral infections per year, especially with attendance in daycare or school. And each of these can cause a cough that lasts about a week or two. And so some coughing throughout the year in childhood is expected. But like I said, when a cough lingers beyond a month or keeps coming back, that's when it's time to dig a little bit deeper. First, let me share warning signs that come along with a cough or patterns that accompany a cough that suggest that we should dig a little deeper. And that means it may start with talking to your pediatrician or a specialist, in this case, a pediatric pulmonologist. One will be if the cough is accompanied with episodes of trouble breathing, of breathing fast, heavier. That is a concern. The other thing is if there's consistent nighttime pattern, either with falling asleep, a cough that comes throughout the night, especially apart from those viral infections that we mentioned earlier on. Also, when a chronic cough is accompanied by a situation where a child can't keep up with their friends during play, at gym, in specific sports, or they're avoiding activities they used to love, like swimming. And occasionally, a chronic cough, a cough that's consistent, that's associated with poor energy, weight loss, poor appetite, or causing them enough to miss school. These are all red flags and it should mean that you should discuss with your pediatrician right away. Or if already connected, you should be referred to see a pulmonologist. Now, when a cough won't quit, there are some common culprits, and we'll mention a few of them. One common cause in children is asthma, and before they are formally diagnosed, we use this clinical term of reactive airway disease. So you could have heard a formal diagnosis of asthma or the clinical entity that we refer to as reactive airway disease. Many times people associate, just a word about this, many times people associate wheeze with asthma. But there are times when a chronic cough is actually sometimes either the only or the most significant significant symptom that leads us to find that a child may have asthma. Another one is a post-viral cough. After certain infections, the airways can be hypersensitive or remain irritated for a while. So think of it like a bruise inside the lung, with the lung needing significant time to heal. The other one another entity that we see that's common is something we refer to as an upper airway cough syndrome. Sometimes an adult may have that feeling that we call the postnasal drip. So that's when there's accumulation of mucus in the upper airway in kids whose sinuses are not fully formed, but it's still in that region of the upper airway, and it constantly trickles down, and it may cause a cough or a desire to clear the throat. Depending on the age of the child, it could present along with other symptoms. Another one is that it could be related to gastroesophageal reflux. That just refers to the term we use for referring to stomach acid going back up into the food pipe, and sometimes the irritation in that area spills over to irritate the airways, which is like a neighboring pipe, causing a cough. It might be worse when the child is lying down or right after food. And at this age, and many kids are not able to describe the word burn that an adult will use. And then there are several other entities, and sometimes it's something related to the vocal cord. We refer to so some type of laryngospasm is the cause of the cough, and there are a few less common but significantly important. Sometimes it's a foreign body, sometimes an infection, sometimes it's a genetic condition, and sometimes it's exposure to environmental irritants. So when you bring your child in to CLAPS here in our office, what you can expect if you've come with a concern of a chronic cough, we will take a detailed history. We're interested in knowing everything about it. So we use our intake questionnaire. We take a history from you when you're here. We also do a significant focused exam on the lungs and the upper airways. We're looking for signs of allergies and exposures. And we have formal diagnostic tests that we do in the office as well. We do spirometry when appropriate, a test called impulse oscillometry. If necessary, we order x-rays. And then ultimately, we develop a treatment pathway that is entirely focused and crafted around a particular child. So there's no one size fits all. Even with our testing, it's not one size fits all, depending on what's happening. And so if we find asthma, we come up with the evidence-based guidelines to minimize steroid use. We want to maximize control. We want to teach you the difference. We want to know as many triggers as we can, avoid what we can avoid. When we find upper airway issues, we do focus treatment. Sometimes we refer. When it's reflux related, depending on the age of the child, if there's additional investigations, we order them and we advise dietary modifications. We refer as appropriate. For vocal cord issues, many times we start with breathing exercises and techniques, and then if there's necessary, we recommend behavioral interventions and speech therapy. Ultimately, the key is accurate diagnosis. Treating asthma when a patient has a vocal cord dysfunction won't help, and it can be frustrating to everyone. So while you're waiting for an appointment, here are some things you can do. Keep a note of the pattern around the cough. Is it a situation where your child is coughing more outside than when indoors? Coughing more with activities, or with some activities, but not certain activities? Also, in the meantime, absolutely ensure good hydration. Continue to encourage kids during respiratory illnesses. Is very important to keep the mucus that's in the airways thin and able to move out easily, but also to compensate for all the air and moisture that's lost in the airways. As we approach the winter months, it's the air in most homes are dry, and so making sure that our homes are not too dry. If needed, with strict care protocols, we can use a humidifier. As much as possible, continue to avoid irritants. So secondhand smoke is a no-no. Strong fumes from chemical cleaning agents are very irritable to the airways and make the child more susceptible to significant inflammation during illnesses. Elevate the head of the bed if necessary, especially for children who may have a reflux issue. Follow all the reflux protocols if appropriate, and don't suppress a cough unnecessarily. Over-the-counter cough medicines rarely help a chronic cough and are not recommended for young children. The cough is a reflex in your child's body trying to clear the airways. We need to address the underlying cause, not just silence a symptom. I want you to know that the vast majority of children with chronic cough get better when we identify and treat the underlying cause. I've seen children go from missing school weekly to perfect attendance. I've watched kids who couldn't make it through soccer practice become star athletes. Here at CLAPS, we measure success by decreased emergency room visits, decreased hospitalizations, a child's ability to excel in sports and activities they love, fewer missed school days, better quality of life for the whole family. And these aren't just numbers, they're real improvements in your child's daily life. So, if your child has been coughing for more than 3 or 4 weeks, or you're seeing any of those red flags that we discussed, don't wait. Trust your parental instinct. You know your child best. Here at Children's Lung Specialists, you can reach us at 973-949-0270 or on our website, www.clapsmd.org. We're located in Wayne, New Jersey, and we accept most insurance plans. We have minimal wait times for appointments because we know that your child can't breathe easy. When your child cannot breathe easy, you need answers now, not in 3 months. Remember, persistent cough is not normal, and your child doesn't have to live with it. Let's work together to help your child breathe easy. I'm Dr. Fari, and I'll see you soon.